So welcome to the studio today, our guest, Dr. Vijita. Good morning.
Good morning, doctor.
And welcome to our Doctor Show.
Thank you so much for inviting me.
So let's begin just in general to know Dr. Vijita. Who is she?
I'm Dr. Vijita. I am a stroke rehabilitation specialist. I have done my master's in stroke rehabilitation and I've been working with stroke patients for the past decade and a half. And I've worked really very closely with adult stroke patients.
Why did you pick strokes of all specialization possible in medicine?
Stroke is such a debilitating disease, Professor. I can't imagine myself not picking up a cup of tea for myself or not able to wear my clothes by myself. People after having stroke, they just lose upon the basic functionalities of their daily living. The right to have a dignified life is important. So that is why I chose stroke rehabilitation, because that's an area which is not looked upon.
Have you had patients recover? What has been your experience?
So I have worked very closely with patients who have got stroke almost 4 to 10 years back, and I have made them even drive back and get back to their work or get back to gymming in whatever way they like. So that has been some happy moments in my career.
Excellent. So you came to run our stroke camp and a teledoctor here in Zambia and Medirehab, seeing over 60 Zambian patients. How did it go?
I was overwhelmed with the response. The thing which I found missing in the rehabilitation in Zambia was that the time duration given for a stroke rehab is very, very less. So people are subjected only for about 2 days in a week for stroke for about 30 minutes, and rest of the time they are doing nothing. Actually, the protocols which have to be followed are somewhere there's a huge gap in that.
So talk to me about these protocols that we and you are coming together to offer to the Zambian public. How special are these protocols for care and how do they work?
As I said, just 30 minutes of rehab is not enough. After a stroke, the brain has to be subjected to relearning the things, and that can only happen when we subject the brain for a particular amount of time during a day, and obviously during the week as well. So it has to be about 5 to 6 hours. The patient has to do the things repeatedly. If they do not do this, they go into a non-use syndrome, and that is why they lose a lot of functionality.
I see.
So the protocols which we actually make the patient use the affected part a lot. Which is the left hand is not working. The patient adapts a lifestyle wherein he is just using his right side and just completely neglecting the left side. So what we bring in our protocol, the use of the affected side is more. So that brings a lot of good recovery in the patients after stroke.
Excellent. And then you do offer also the online consultation. Assuming somebody is in Zambia and you are in India, how do you do that?
So basically the patient just needs a good internet connection, and if possible a family member or an attendant on their side. We do not have pre-recorded videos. We make a customized protocol according to the condition of the patient, and we demonstrate few exercises on the other side which the patient has to do on here with the help of the attendant. And that is how we deliver it online.
You talked to me about that most of your patients seem to have one condition which leads to stroke. Could you just tell the Zambian people what that is?
So the main problem I found in the patients here is, one is hypertension, and second is they are very irregular with their medications of hypertension. So either they stop it on their own, or they do not consult, or they do not go for their reviews, because sometimes the patient's BP is really high but they are taking very low doses of hypertensive drugs. Or sometimes they just abruptly stop taking the drugs. So this is the main reason I found that the patients are very predisposed to stroke. And also secondly, there's high amount of people, especially younger generations, who are into alcohol and also smoking, which is again predisposing to hypertension or high blood pressure, which is leading to stroke.
What is the advice to the population?
So one thing is that they should not go for self-medications. They should not, stop their drugs without the advice of a cardiologist or their neurologist. And secondly, they should avoid taking too much of alcohol and smoking. This is what I found as the major contributing factor to having stroke, especially at the younger age.